Hey everyone, Dr. Jeff Peng here. This is a summary table of all the most common treatment options for knee arthritis. There's a lot of information here, and my goal is to simplify everything and go over the ones I recommend to my patients who suffer from knee arthritis. Let's dive right in. Now, if this is your first time watching one of my videos, my goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Osteoarthritis of the knee is a chronic disease that can have a devastating impact on quality of life and day-to-day function. And in treating many people with knee arthritis, I've found that most people have a limited understanding of what it is and how to manage it. And so by far the most important thing that I want my patients with arthritis to understand is that osteoarthritis is no longer something that you should suffer through and just deal with it. It's something that you want to actively treat and something that you want to actively manage. Think of arthritis like aging. We can't reverse aging, but there are a lot of things that we can do to potentially slow down the effects of aging. Daily exercise, proper nutrition, getting good sleep, prioritizing mental health, all of these things will impact how we age, and much is the same with arthritis. Once you have it, we can't reverse it and we can't get rid of it, but there are a lot of things that we can do to treat it and change how arthritis manifests. Think of it in another way. If you have high blood pressure, you will want to take a daily blood pressure medication to try to control it. We don't wait for someone to have a heart attack before telling them, oh, now is a good time to treat your blood pressure. The same is true for arthritis. If arthritis is left untreated, it will get worse, and we don't want it to get worse because that leads to worse outcomes. And this is why I recommend a multimodal approach to treating arthritis, and everything is summarized in this table. Now, I know there is a lot of information here, but let's break it down together. I like to approach treating arthritis using 4 big categories. The first 3 categories are treatment options that provide short-term pain relief, treatment options that provide long-term pain relief, and treatment options that improve the integrity of the joint and decrease the risk of getting a knee replacement. Now, with every treatment option, we also want to take into the account major risks or side effects, and that is the 4th big category. Okay, so I want to first start down here. These are the treatment options that I recommend using sparingly or ones that I really don't recommend. There are a lot of misconceptions around these treatment options, so I really want to try to clarify them. The first treatment option is oral pain medications. These include pain-relieving medications such as tylenol or opiates, as well as anti-inflammatory medications such as ibuprofen or Voltaren gel. So let's first talk about Tylenol. Tylenol or acetaminophen is perfectly safe as long as you don't have any liver disease, and that's because Tylenol is cleared from the body by the liver. So if you do have liver problems, then you will have decreased clearance of Tylenol, and it can build up to dangerous levels in your body, and that would be bad. Now, with that said, if you don't have liver issues and Tylenol works well to control your pain, then it is actually a great treatment option in providing short-term pain relief. The next class of drugs are NSAIDs. These are non-steroidal anti-inflammatory drugs, and examples include ibuprofen or naproxen. These actually work really well in treating short-term pain from arthritis, specifically because of their anti-inflammatory effects. But NSAIDs have much more dangerous side effect profile, especially when compared to Tylenol. When taken for a long period of time, NSAIDs can cause problems to the heart, the kidneys, and the stomach, and they can also increase your risk for heart attacks and strokes and can cause dangerously high blood pressure. So anyone with any type of cardiovascular disease needs to be extremely cautious when using NSAIDs. With that said, when used sparingly, they can be effective in treating short-term pain, but they should never be used long-term without first checking in with your doctor. Now, one way to get around all of this is to use a topical NSAID such as diclofenac gel. This is much more safe and is available over the counter at any pharmacy or online at Amazon. Diclofenac gel is an anti-inflammatory medication that is applied to the skin and it acts locally. It works really well for some people and it avoids all the dangerous side effects of taking pills. Now, what about opiate medications such as hydrocodone or oxycodone? Opiates have significant pain relieving properties. However, they come with major side effects and are extremely habit forming. I do not recommend using opiates in the treatment of arthritis because their side effect profile is so dangerous. Now, the important thing to keep in mind is that oral pain medications only target short-term pain relief. It does nothing to help with long-term pain, and it does not have any effects on arthritis progression. They really just serve an important role during arthritis flares, but should not be used as a good long-term solution for treating arthritis. Now, what about steroid injections? Steroid injections or cortisone injections are extremely strong anti-inflammatory medications, which we can put in a syringe and then inject into a knee with the hope of decreasing pain and decreasing inflammation. They work pretty well for short-term pain, but for most patients, the pain-relieving effects are short-lived, usually on average 1 to 3 months. They have no long-term pain-relieving effects, but the bigger concern with steroid injections are their side effect profiles. Multiple studies have shown that steroid injections can cause long-term structural damage to the knee. Steroids are chondrotoxic, meaning they damage the cartilage and increase the risk of causing more arthritis in the future. One recent study even reported one cortisone injection significantly increased the risk of developing rapidly destructive joint disease. So with steroid injections, you are getting short-term pain relief at the cost of long-term damage. Now, with that said, if a one-time steroid injection is what is required to get you back on your feet and moving and participating in the other treatment options that we will go over, such as exercise therapy and weight management, then it still serves a role. I am just very cautious about putting more than 2 cortisone shots in a person's knee unless they already have lost all of their cartilage and are already bone on bone. Otherwise, the risk of cartilage damage is just too high, especially when there are a lot of better options. Okay, what about knee arthroscopy, or more commonly called a knee scope? Why can't a surgeon just go in and quote-unquote clean everything up? Well, that's what used to be done, and knee arthroscopies have been studied extensively in the orthopedic literature for degenerative knee disease. Bottom line, multiple randomized controlled trials and systematic reviews have shown that over the long term, people who get a knee scope compared to those who get conservative, non-surgical treatment do not have any significant difference in pain or function. But the people who get a knee scope or a partial meniscectomy actually have higher rates of arthritis in the future, and they also have a slight risk for complications during surgery. And because of all of this, we no longer recommend arthroscopic surgery for the treatment of arthritis. Okay, so what about treatment options that I actually do recommend? Let's first talk about the 2 most effective treatment options for knee arthritis, and that's exercise therapy and load management. And while these may not provide immediate pain relief, they are supported by many studies, and they seem to be the best long-term option in controlling symptoms related to arthritis. Just remember this phrase, motion is lotion. When we move, we are lubricating the joints. And the day we stop moving, we stop lubricating the joints, and all that stiffness and locking and catching related to arthritis returns, along with all the pain and the swelling. In addition, exercise therapy has been shown to decrease the progression of arthritis and has excellent long-term pain benefits. Exercise therapy is also incredibly important to restoring function. People who have pain for a long time tend to be weaker in their affected leg. For example, if I am suffering from arthritis in my right knee, I tend to favor my left. Over the course of weeks to months, the right leg becomes weaker and weaker, and that's because our bodies are trying to protect it by offloading it. This results in muscle atrophy. So exercise therapy helps not only by reducing pain, but also by restoring strength. Exercise therapy is by far the most important treatment option for everyone who suffers from arthritis. And great examples of exercise therapy would be low-impact sports such as swimming, walking, elliptical, or cycling. Now, just to review, the CDC and the American Heart Association recommends 150 minutes per week of moderate intensity exercise, preferably spread throughout the week. Now, this might sound like a lot, but all it is 30 minutes brisk walk 5 times a week. Now, if you can get more than this, the effects would be even better. Now, right up there with exercise therapy is load management. Load management comes in 2 varieties. The first is activity modification. Are you doing anything repetitive that involves constantly overloading the knee? If yes, you may need to modify that activity. For example, we know recreational running is actually beneficial to those with knee arthritis and actually prevents arthritis from getting worse. But extreme high-intensity interval training or elite long-distance running can be detrimental and cause more arthritis. So it's all about making adjustments and modifying. I often advise my long-distance runners to incorporate more cycling or swimming or even running on an elliptical so that they can still get a great workout but not overload the knee. Now, the second aspect of load management is weight, and this is a simple physics problem. The more weight you carry around in your body, the the more you are loading your joints and your knees. For every 1 pound that you weigh, your knees will feel 2 to 3 times the amount of force going through it. Over time, this is going to overload the knee and lead to more arthritis. And so exercise therapy and weight management go hand in hand. Diet also plays a critical role. In general, you want to eat an anti-inflammatory diet, one that is rich in fruits, vegetables, nuts, beans, and whole grains. A great example of an anti-inflammatory diet is the Mediterranean diet. These foods are rich in antioxidants and nutrients that can help reduce inflammatory signaling cells and decrease cartilage degradation. Everyone who wants to actively manage their arthritis really needs to pay attention to diet, weight, and exercise. People who are successful in making these lifestyle changes have significantly decreased risk of getting knee replacement surgery. Okay, let's talk about knee injections now. There are actually much better options out there besides cortisone. The first option is called viscosupplementation. Other names that it goes by are hyaluronic acid and gel shots. These are synthetically made molecules that help lubricate the joint. They have pain-relieving effects as well as anti-inflammatory effects when injected into a knee. Now, an important thing to point out about viscosupplementation is that there is a lot of back and forth in the medical literature about whether or not they work. Initial studies said that they worked great. Then more studies came out, and these were less impressive. And because of the back and forth, many insurance companies no longer cover these injections. Now, with that said, many medical societies, such as the American Medical Society for Sports Medicine, continue to recommend the use of viscosupplementation in the treatment of knee arthritis. The most recent studies suggest viscosupplementation works in terms of providing short-term and long-term pain relief. More importantly, long-term studies show that people who get ultrasound-guided viscosupplementation injections have such a great benefit that it delays the need for a joint replacement surgery. The only potential downside of viscosupplementation is the possibility of an allergic reaction, but this is extremely rare. If covered by insurance, viscosupplementation is an easy choice over cortisone injections. It can greatly benefit 3 of the 4 major categories with an extremely low risk of side effects. Okay, so what about PRP? PRP stands for platelet-rich plasma and is the latest and greatest in terms of what we are using in treating knee arthritis. Now, I made an entire video explaining why PRP injections are so effective in treating arthritis, so check that video out for more details. Head-to-head trials comparing PRP to placebo, PRP to cortisone, and PRP to viscosupplementation shows one clear winner. PRP has better effects in treating short-term pain and long-term pain. More and more studies are also showing that PRP injections can improve the biochemistry of a joint to prevent further structural loss as well as delay the need for a knee replacement surgery. And the beauty of PRP is that we are using your own cells, your own platelets, and your own growth factors to treat pain and to treat inflammation, so you can get as many of these injections as you want without any fear of side effects. This is why I give PRP injections a moderate to high recommendation for treatment. Remember, the most important thing about knee arthritis treatment is that we want to take a multimodal approach. We want to use multiple treatment options that will target as many of the 4 big categories as possible. And because of this, I routinely encourage all of my patients to not only work on exercise therapy as well as weight and load management, but also to consider injection therapy, specifically using either PRP or viscosupplementation. Taking this multimodal approach will put you in the best position possible for success so that you can continue to live an active and healthy lifestyle. Now, if you found this information useful, please consider liking the video and sharing with others. Thanks for watching, and I'll see you next time.